Have you noticed that your skin's become thinner, drier, probably a little more sensitive, and you're also losing hair on your scalp around the age of 40? If these symptoms resonate with you, today's video is going to make a lot of sense. I'm Dr. Jyoti Aneja, your aesthetic dermatologist with over 16 years of experience in dermatology and aesthetics. My heartfelt goal is to support and guide you on your journey to healthier, more radiant skin and hair. Because I truly believe everyone deserves to feel confident and comfortable in their own skin. Maybe you feel that your glow does not look the same anymore. All the fine lines suddenly look deeper. Your jawline has become softer, your scalp's become more visible, skin is overall more sensitive, and the products that worked for you all these years long have suddenly given up on you. If these are the complaints that you're also dealing with, trust me, you're not imagining it. Very often, it is the pause that's beginning to show through your skin and your hair. Yes, you heard me right. I'm speaking about the devil that we all know, perimenopause and menopause. And why I call it the devil is because most of us are prepared so much more and better for puberty than menopause. And perimenopause is the period before you actually hit the menopause, and menopause by itself does not start the day your periods stop. It could be a time which is anywhere between 5 to 10 years till your periods could actually stop. Some women experience it in their late 30s these days to mid 40s, and some women carry to menstruate even in their 50s. So anytime between your late 30s to your mid 50s is when menopause could hit us. And as a dermatologist, I can tell this way before the patient can actually connect the dots themselves, that is it anything else or is it plain simple menopause hitting your skin and hair? Because estrogen is deeply connected to collagen production, to your hydration, to your skin thickness, to your overall brightness, glow, even your hair and scalp health. So when your estrogen levels start declining, the body responds very fast. So what you notice is that your skin has suddenly become very sensitive. Your skin feels dry, it lacks luster, your hair seems very thin, you experience a lot of hair fall also. A lot of patients complain of pigmentation, especially around the cheeks, pigmentation that was not there for all your life, and suddenly you feel there's a butterfly-shaped pigmentation that's come out onto your cheek. We also call it melasma, and it is not just restrained to your cheeks. You may find that around your mouth as well. You may experience jawline acne. You may overall feel that your skin has started to sag and it does not have the support and structure that it did till about a while ago. And almost on a daily basis, I have the most fit women come and tell me, Doc, I might just look the same, but I don't feel the same internally. So this is not something that you're making up. This is biology slowing you down. In fact, women can lose a significant amount of collagen in the first few years of your menopause, is why your skin starts looking less supported, your hair starts looking weaker, and you overall feel dull. And this is something that we can very beautifully support if the approach is more regenerative and preventive, and all that you got to do is listen to your body and watch the signs. And we do need to take a note that stress, poor sleep and cortisol changes can only make matters worse during this phase of our life. This is a phase where we do not need aggressive anti-aging treatments. So you need to focus on your protein intake, on your diet, on your well-being, nutrition, make sure that you're working out and start working with your regenerative treatments as soon as you notice the first sign. I usually tell my patients the goal is not to look 25, but the goal is to look healthy, supported, in control of your body, mind and skin, irrespective of your age being 35, 45 or 55. And honestly, if you have a mother, sister, friend, wife going through this phase, all that you got to do is be kinder, because this is not just something where your body is changing physically, it's a total body transformation. You're going through a full body hormonal shift and it is not easy. Women deserve understanding, support, care and warmth while going through it. So now what works for women going through menopause? Now this is when I tell my patients you need to stop figuring out aggressive anti-aging treatments and start focusing on your metabolic well-being, your regeneration, your overall health and recovery and restoration. Because menopausal and perimenopausal skin and hair respond the best to what is fed on the inside more than what is done externally. here are my top recommendations. Prioritize protein, strength training is a must, and do not underestimate the power of sleep. You lose collagen, so the need is definitely higher. We need to add about 20 grams of protein in every meal irrespective. Strength training even 3 to 4 times in a week will make a world of a difference, and sleep, my dear, is your best friend. Poor sleep increases your cortisol, inflammation, and eventually collagen breakdown, so that's your enemy right now. You need to focus that you have to get in bed at a given time every day. And nutritionally, I encourage my patients to have food that's rich in omega-3s, to have your seeds, your dates, your nuts, to make sure that your plate looks balanced and colored. A diet that focuses on good protein intake rather than spikes and crashes, and just focus on stable blood sugar levels. Now, what do we avoid? Just make sure that you're not over-exercising, you're not going around doing any crash dieting, you're not having excess alcohol, no smoking, avoid a lot of sugars, and do not be stripping your skin by using a lot of harsh skincare products. For skin, we focus on treatments that help us with collagen stimulation. Personal favorites, we've got microneedling, radiofrequency, it could be monopolar or bipolar. We've got a lot of lasers, we have skin boosters, collagen stimulators, regenerative therapy in the form of PRP. A lot of growth factors are being injected. We have polynucleotides, and the latest is exosomes that help us regenerate your skin. For hair concerns, depending upon the individual, we may need to evaluate your iron levels, your vitamin levels, look at your hormonal changes, run a couple of blood tests, and overall help you with growth factors, regenerative therapies, PRPs, a lot of Regeneras, exosomes, and hair boosters to support hair shedding and stimulate hair growth. Because this phase is not about chasing perfection, it's about supporting women intelligently while we are going through a very, very real biological transition. One thing I noticed very commonly during perimenopause is that women suddenly start over-exfoliating their skin because it begins to look dull or textured. This is usually the phase where the skin needs less stripping and far more repair. Another thing I see all the time is women continuing the exact same skincare routine they used in their 20s and 30s, even though menopausal skin behaves very differently. The skin barrier becomes thinner, slower to recover, and much more reactive. So products that once worked beautifully can suddenly start causing irritation. And honestly, this is also the phase where sunscreen becomes absolutely non-negotiable. Estrogen decline makes the skin more vulnerable to pigmentation, collagen breakdown, and damage. So even beautiful in-clinic treatments won't maintain well if sunscreen is inconsistent. I also tell my patients not to ignore scalp health during this phase, because hair thinning is not only about hair strands themselves. It's often connected to inflammation, hormonal shifts, stress, protein intake, your iron levels, and your overall scalp health, which is why simply changing shampoos is usually not enough. This is also one of my favorite phases to introduce a regenerative skincare routine where a well-formulated retinol, peptides, growth factor-based skincare like Skin Jewels Fountain of Youth can help us feel beautiful and make your skin quality so much better than before if used consistently and intelligently. I'm Dr. Jyoti Aneja, and if today's video resonated with you, or if you think this can help your mother, your sister, your wife, or even your girlfriend, do make it a point to share it with them, and we'll keep coming back with more such videos.